Thank you, everybody, for attending today's Lunch and Learn on e-prescribing in Gentu. My name's Alexi Bear, and I'm the National Customer Training Manager here at Genie Solutions, a Magenta's company. I'd like to begin by acknowledging the traditional custodians of the land on which we stand. For me in Perth, this is the Whadjuk people. I'd also like to pay my respects to elders past, present and emerging. Today, we're going to take a look into e-prescribing in Gentu. We'll start off with what is e-prescribing and then have a look at what are the requirements to use e-prescribing, including all of the appropriate registrations. We'll then go through how to set up Gentu to actually use it, how to create and modify an e-prescription, and answer some of your frequently asked questions. At the end of the presentation, we'll have time to answer any other questions you might have about e-prescribing. If you have any questions, please submit them into the Q&A box at the bottom of the Zoom window, and we'll get through as many of these as we can. So what is e-prescribing? E-prescribing is a system that allows for prescriptions to be sent to the patient electronically rather than on a printed form. This could be via either SMS or an email. The SMS or email will contain a link that goes through to a QR code. The patient can open the link and the pharmacy will scan the code, then dispense the medication. This has many benefits, the biggest being that it's much harder for a patient to lose their phone than it is for them to lose the paper prescription. It's also fantastic for practices who primarily use telehealth, as the script can be sent direct to the patient without them needing to come into the rooms and pick it up. There are several requirements as part of setting up e-prescribing in Gentu. I'm going to spend the first part of today talking you through each step in detail. In some cases, you may have already completed some steps or started the process. This section here is one that you might wish to watch back and replay when you go through each step. We'll send out the recording within a few days. I've listed here the most common acronyms on this slide so that it can help you out when you come back, as it can get a bit confusing. The first step required is to sign up with the MIMS integrated medicine base. MIMS is Australia's most trusted provider of medicine information, and as part of using the MIMS database, you'll have access to a very comprehensive list of TGA approved items for prescribing. We often do get asked, why do you have to use MIMS in order to use e-prescribing? The reason is that all medications as part of the prescribing process need to comply with active ingredient prescribing. MIMS provides this compliancy while also allowing us to create a fast, agile search option so as not to take away from time with patients. Given that MIMS is Australia's most trusted source of information, this also made our choice about who to integrate with very easy. To make this integration as easy as possible for each provider, MIMS can be subscribed to directly in Gentu, no need to phone them or email. MIMS subscriptions are per practitioner, so you'll need to just subscribe any doctor in your practice who would like to use e-prescribing or would like to use MIMS for their paper prescribing. In settings, under Manage Users, you can select a provider. Then in the Prescriber tab, you'll need to ensure you have the prescriber number added. In the MIMS tab, you can then toggle across to subscribe to the MIMS integrated system. For those who've not yet used PRODA or HPIO, there are a few different roles, and each role is able to complete different tasks. The role of responsible officer is the person who owns the practice or is the CEO of the organisation. Their role is typically responsible for interactions with the HR service and to ensure employees comply with legislation. The Organisation Maintenance Officer is usually a practice manager, and their role is to keep information up to date. Then finally, the Medical Practitioner is usually the doctor and has the ability to add healthcare identifiers and to search for IHIs. Now, in a smaller practice, it is entirely possible that one person may be doing all three roles I have listed here. For example, if it's a single doctor practice that doesn't have a dedicated practice manager, You may have all three of these roles assigned to the doctor. Step 2 involves registering with PRODA if you haven't already done this. Each practitioner will need to be registered, and registration can be done by either the responsible officer, Organisational Maintenance Officer, or the medical practitioner themselves. This process does require proof of identity. And if you're already using My Health Record in Gentu, you will have already done this, so you don't need to do any more here. There are 3 steps when registering for PRODA. You need to provide your details and create an account. You need to verify 3 different forms of identification, and you need to link your services. We don't have any visibility on issues you might encounter with registering with PRODA. So if you do have any, please contact them directly and they'll be more than happy to help. We've listed their support details just on the right of this screen in case you do need to get in contact. Now, when you're registering, you need to have the 3 identity documents. This is a list here of which documents they're going to require. The 3rd step is to link PRODA to HPOS. This can be performed by the responsible officer, Organisational Maintenance Officer, or the medical practitioner. Once again, this is a step that our team can't assist with, so please direct any inquiries to PRODA directly, that same contact that was on the last slide. For anybody who is using My Health Record in Genie, you will have already done all of this, so you can skip ahead. So if you haven't done this, how do you link your PRODA with HPOS? To link, the first thing you're going to need to do is log into PRODA. When you log in, there'll be a link identifiers option in the available services section. You'll be asked to answer a few questions and insert your identification information. Then read through and agree to the HPOS terms of use. Once you've done that, insert an email address that's regularly checked. HPOS is going to notify you through that email if there's any messages, so you want to make sure you don't miss that. And then once it's all done, click Submit. At this point, you should have a HPOS tile now sitting in your PRODA account, and you're ready to move on to the next step. Step 4 is to register your HPI-O or link your existing number in PRODA. Only the responsible officer can register for a HPI-O, and if you're yet to have an HPI-O issued, you will need to register. If you've already got a HPI-O, it will need to be linked to PRODA. This is not required if you're already using My Health Record, as once again, you will have already done it. To register for a HPI-O, you'll need to first log into PRODA. In the available services, you'll find that HPOS tile that you set up earlier. And then in My Programs, choose Healthcare Identifiers and My Health Record. Select Healthcare Identifiers and register seed organisation. Then register your seed organisation by following the steps in the online form. Once you have your HPI-O sorted, you're ready to move on to your HPI-Is. So, HPI-Is. Any doctor will need one of these to use ePrescribing, as these are the individual identification numbers. So if you've already registered with APRA, you already have a HPI-I. Registrations can only be performed by the responsible officer or Organisational Maintenance Officer. And if you use My Health Record, then you can skip this step because you've already done it. To register or link a HPI-I, you'll need to log into HPOS. This is done through PRODA. Then navigate to My Programs, HealthLink identifies on My Health Record, and manage existing records. Select your organisation from the list, and within the My Organisation details, go to the HPI-I links tab. Click Manage Authorisation Links. enter the unique HPI-I for your provider, then click Submit and repeat for any other providers you might need to link. Up to step 6, we're more than halfway there. So at this point, this is when you get to link your organisation with Genie Solutions as a contracted service provider. A contracted services provider manages or communicates healthcare information for a healthcare provider, which in this case is Genie Solutions. So this step of the process can also only be performed by the responsible officer or organisation maintenance officers. And this step involves linking your organisation with Gentu, as well as linking Genie Solutions with My Health Record. Once again, if you're already using My Health Record, you can skip ahead. So there are a few steps to link your organisation with Gentu. First one, once again, we're logging back into HPOS using PRODA. Navigate to My Programs section and select the Healthcare Identifiers and My Health Record option in My Programs. In here, select Healthcare Identifiers, Manage Existing Records. Select My Organisation Details from the HI Services Available list. Then navigate to the CSP Links tab. Once you're there, click the Manage CSP Links. Enter the 16-digit Genie CSP number. This is on the knowledge base. You don't need to quickly write it down now. And select the CSP for Genie Solutions. Then once you're all done, click Confirm. Once Gentu is linked, then you need to link the CSP with My Health Record. So within HPOS, navigate back to My Programs, HealthLink Identifiers, and My Health Record. Choose the My Health Record System Organisation Registration option. And in the Manage Authorisation Links section, click Add Update Links. In here, pop in that 16-digit Genie Solutions CSP number. And once you've done that, you can click Submit and then Confirm. Step 7, you need to get in contact with us to register. This can be done by anybody at the practice, and it's just by filling out the registration link, which is on our knowledge base. We've also got it here for anybody that wants to go straight to it. When you fill out this form, what we're going to ask for is your GTU number, your practice name, your practice address, your practice phone number, email, and most importantly, that HPIO number that you got earlier. Once that's completed, we'll receive it, process it, and then you'll receive a confirmation email or call from our team. When prescribing medications electronically using e-prescribing, the usual legal paper prescription is replaced with electronic prescription data that is then stored in the Prescription Exchange Service, or PES. This PES is managed by a third-party company, and for e-prescribing, we're currently integrating with ERX. So after an electronic prescription is created in Gentu, it'll be transmitted and stored in the PES in an encrypted format. And once this legal prescription is in the exchange, pharmacies can use conformant dispensing systems to retrieve the prescription data and complete the dispensing. For this to happen, the very first step is that you need to register with ERX and complete their online form. So to complete this form, you're going to need the prescriber number, and then in the drop-down list to choose Gentu as the prescribing software. You will notice that Genie Solutions and Genie Solutions Electronic Prescribing are also options in there, but your correct one will be Gentu. This registration won't be instant. It is a manual task for ERX to onboard registrations, so it could take a few days to be active. They'll let you know when it's done by emailing you through a registration number. And with that, we're up to the last step to activate it. So the last step is to add your details into Gentu itself. You'll need to activate it for each user, and you'll need to ensure that all prior steps and prerequisites are complete before you activate. To successfully activate e-prescribing, there are compulsory fields that need to be completed in both the practice and user preferences, found under the settings icon. In practice preferences, these are street 1, suburb, state, postcode, phone number, and HPI-O. In the user preferences of any practitioner who's going to be using e-prescribing, the personal details must contain first name, last name, qualifications, work phone, mobile phone, and HPI-I. In the prescribing tab, you'll need to enter prescriber number, prescriber type, ERX sender, which is that number that ERX will send you to confirm registration, and tick the box for activate e-prescribing. You can check if you've met all the e-prescribing requirements within Gentu using the checklist on the right-hand side that shows the status of each step. You can't tick the activate box until everything else has been completed. Once that's all done, it gets really exciting. You're actually set to start using e-prescribing. For a patient to be eligible to receive an e-script, the minimum requirements in their record are first name, surname, date of birth, street 1, suburb, postcode, Medicare number, and IHI. But don't worry about trying to chase down patients for the IHI. If you have all the other details correct, then Gentu will auto-populate this for you. So, how do we actually create a script? To create the script, select the plus sign next to the medication. Then start typing the name of the medication and select the correct one from the list that pops up. In this case, the one we've chosen is streamlined authority, so you'll need to choose the authority reason to make sure the correct code is added. Then you'll be able to type in the dose and the frequency, plus any additional patient instructions. Once that's done, select whether you want to print the script or whether you're going to create an e-script to send by SMS or email. Then choose any extra prescription details that are required. Tick to confirm that the details are correct and select prescribe. At this point, your prescription will be submitted to ERX and the link will be sent to the patient. So how do we modify an e-script? To edit an e-script, select it from the medications list. You can see when they're e-prescribed as there will be text underneath the medication name. And this will then show you all the script's details. At the bottom of this window, you can choose to reprint a token if you want to print it out on paper and give it to the patient. You can choose to reissue the token so that they receive it electronically, or you can choose to cancel the token. If the medication has already been collected, though, you will get a failed message when you try and cancel it. So when the e-prescribing window appears, there were a lot of other options on the right that you can utilise. Our knowledge base has the descriptions of what each of these are if you do need to double check, so you don't need to furiously write notes on them now. The first one was closing the gap, which indicates that the patient is eligible for the Closing the Gap PBS co-payment program. Unusual quantity indicates if there's an unusual quantity in place for this medication. Unusual dose indicates if you've chosen an unusual dose in place for this medication. Any medication prescribed where the dose is considered dangerous or unusual should be marked as unusual dose. Setting this to yes acts as an endorsement for the dose. No initialing is required for e-prescriptions. Unlisted item repatriation authority indicates a medication when requirements for unlisted repatriation authority. This is applicable for patients with a DVA card and where the medication is indicated on the RPBS. Exclude from active script indicates if the medication should be included or excluded from the patient's active script list. And dispense or repeats, Regulation 49, indicates that all repeats of a PBS prescription can be supplied at the same time. Emergency supply indicates if the medication is being prescribed under an emergency supply. If the emergency supply flag is indicated, a token is not generated for the patient. Print a paper token indicates the patient wishes to receive a paper printout of their e-prescription token in addition to the e-prescribing method selected. S8 class is only selectable for extemporaneous medications and must be selected each time one of these medications is prescribed. Prescriptions from the MIMS database will have yes or no automatically selected depending on the medication schedule for you. Repeat intervals indicates the number of days between repeats. This field only accepts a numerical figure. You can specify the repeat interval for this medication if relevant, and this might be required for some high-risk medications. Max quantity authorised to dispense indicates the absolute maximum quantity that can be dispensed for this medication, and this field only accepts alphanumeric characters. Authorisation/approval number is a state-based authorisation code needed when prescribing S8 and some S4 drugs. The field name may vary depending on the location of your practice. And finally, notes to pharmacist is a free text field where the prescriber can enter any relevant notes for the pharmacist. This field can be used to make notes that you would usually make by hand on a paper prescription. Annotations free text field is a field similar to writing a note on the bottom of the paper prescription, and to be used for indicates if the medication is to be used for a specific treatment use.